All right, here we go. Let's talk about gowning and gloving your surgeon. All right, so at this point, we already set up our back table. We already did the count. All of these things should be done before the surgeon comes in, before the patient even comes in into the room, right? You're gonna set up your back table. You're gonna do the counts, so on and so forth. At some point, your surgeon's gonna come in, and as we previously talked in the other video, the first thing you're gonna give the surgeon, it will be a towel, right? So, just like the last video, remember, you always have to cuff your hands every time you give a sterile item to a non-sterile personnel. So, my gown and glove is already here. For the whole purpose of the video, let's just say that's your towels, your gown and glove, and everything else is on your back table, which is the rest of the drapes. So, first things first, as always, every time your surgeon comes in, you're always gonna introduce yourself. If it's the first time you work with that surgeon, of course you're gonna introduce yourself. But if it's the second, third, fourth time, you don't have to. Hopefully they remember your name. Hopefully. Okay. So here we go. I'm gonna go ahead and grab my towel. Ooh, you guys cannot see this. I'll have to raise you, baby. All right. So again, the towels are nice and folded to the point that you're just gonna grab those two corners and you're gonna open the towel. Always get your drapes and items ready on top of a sterile field. Do not do it off the field, do it on top of a sterile field. So again, we learned that we're gonna go from here, put our fingers in front of us and turn our hands so we can go ahead and have this. Then next, we're gonna go ahead and lower one side of the towel and place the towel on top of your surgeon's hand, like so. Okay, they're gonna do their thing, they're gonna dry their hands, so on and so forth. Next, let's go ahead and do the gown. Now, my apologies, I'm doing this video by myself. I wish I could have someone to demonstrate it, but everyone is busy. I'm just doing my thing here. So every time we gown ourselves, the back or the spine of the gown usually or should be facing us. That way we can put our hands inside the pockets, correct? So when you are gowning the surgeon, this flips. The spine should be facing your surgeon, so the cuffs or the sleeves are gonna be facing them. Again, we are gowning ourselves, the spine is facing us, right? But when you're gowning the surgeon, this turns around, the spine is facing your non-sterile personnel. Next, again, always cuff your hands. Notice how I'm already holding, or automatically my fingers are going by the Velcro. Those two Velcro straps that you always feel in your gown, the one that get put together on the top. I'm gonna go ahead and, oops, let me move this thing. I'm gonna go ahead and open this all the way. Always stay at sterile level. The neck of the gown is always going to be facing my neck. The chest of the gown is always going to be facing my chest. So, spine towards your surgeon. Open it. Look, automatically I'm holding it by the Velcro straps. Okay? There you go. It's going to look something like this. The sleeves and the cuffs are going to be facing you. Those openings where they're going to place their hands are going to be facing your surgeon. Next, always cuff your hands. Always protect and cover your fingers and your entire hands. That way you will not contaminate. Next, you're gonna approach your surgeon. Okay? You're gonna let them put their hands or their arm inside those sleeves. You're gonna move forward. Once they put their hands inside those sleeves, this gown should reach their shoulders. Once the gown is over their shoulders, push the gown over. Do not go beyond the shoulders, because at that point you're not seeing your fingers. You might contaminate. So, I'm sorry I'm doing this by myself, so I'm trying to do my best here. So again, let them put their hands in. Keep pushing that gown. This should reach their shoulder. Once the gown is on top of the shoulder, push it and come out. We'll demonstrate it once we're in the lab. As long as you can have an idea how it looks, that's all I care. So it's gonna look something like this. Okay? Next, notice how this is flopping back and forward. And then your next thing, after you put the gown on, you are gonna lower those sleeves, and those cuffs should be about halfway down their hands. You need to do both. So you open the gown, you open it all the way, get closer to your surgeon, always cuffing your hands, get to the shoulders, push the gown, just those corners, the Velcro strap over the shoulder and come out. Next, you're gonna lower those sleeves and those cuffs, and you're gonna place them about halfway down the hand, and you're gonna do both, okay? And you're gonna look something like this. That is your job. You wanna expose those fingertips so you can move to the next step, which is gloving the surgeon, okay? We good? All right, so let's talk about the gloves. Here we go. For the most part, you're going to be facing you like so. You should be able to read your gloves right and left. You're always gonna start with the right hand. I don't know why. I guess it's a OI thing. I don't know. You always start with the right. Okay? So, remember, you're sterile. This is sterile. You expose the fingertips all the way down half by the hand, by the palm. Next, you're gonna go ahead and reach your gloves. So we're gonna open them up. Hopefully you guys can see this. Maybe what I'm doing. I don't know. I'm gonna go ahead and open this up. Okay. I'm gonna go ahead and pick up the right. Okay. I'm gonna give it a nice stretch. I'm gonna go ahead and stretch it and remove all that memory. Once this is ready, notice how the thumb of the glove is actually on the other side. It's not facing me. When you're putting your glove on top of your hand to to glove yourself, it's thumb to thumb, right? This is the opposite. The thumb should always be facing the surgeon. The thumb of the glove, which is this one right here, should always be facing the surgeon. So, what I'm gonna do next is, I'm gonna go ahead and put my thumbs, I'm gonna move this mail stand. I'm gonna put my thumb inside the fenestration or the opening of the glove. I'm just gonna use my thumb. Notice how I have the other fingers nice and exposed. But now I'm gonna cuff them. You're always gonna cuff your hands, right? So, I'm gonna stretch the glove just a little bit, and I'm gonna put my fingers underneath the glove, okay? I'm gonna do this again. The best way I can show you this, because a lot of people are gonna wanna do that, lock your fingers inside the gloves. Don't do that. What I like to tell my students is, you have that edge, you have the end of that glove. You see this little line right here on my thumb? I'm gonna place that line against the cuff or against the edge of that glove. So line to line. Okay, next, I'm gonna go ahead and protect my hands. It's gonna look like this. I'm gonna protect my hands. It's gonna look like this. And then I'm gonna stretch the glove. Notice how all my fingers are covered, but my thumb. This is what we call hitchhike, you know? Can I get it right? It's called a hitchhike technique, where we are gonna only cover our hands, but I'm gonna extend that thumb and open the glove so my surgeon's hand can easily get through there, okay? Again, the thumb should be facing your surgeon, not you. This line of my thumb against the line of the top part of the glove. I'm gonna stretch it. Okay, next. 1, 2, 3, 4. 1, 2, 3, 4. And hitchhike. Okay? it will look something like this. Okay, I'm giving enough glove to my surgeons so they can place their hand in there. Okay, if you start doing this, you are not giving them enough glove to the point that they can easily touch you and contaminate. They need to have enough glove, length of the glove, so they can put their hand in. So thumb facing the surgeon, thumb in, cover 4 fingers, hitchhike, and you're done. A lot of us like to do this, which is cover the entire hand, our entire fingers, which is fine. I don't mind that, it's cool. I like the hitchhike technique because I get better control of where I need to go. That's the right. Again, I'm gonna do the left now. Okay, thumb facing the surgeon, I'm gonna remove it, give it a nice tug so I can remove that memory, put it on top of my sterile field. Thumb facing my surgeon. Line to line, stretch it, cover my hands, hitchhike. Here you go, doc. That was your right. By default, this is your left. Always let them know which side of the glove you are giving them. Okay? Once you do that, the next thing they're gonna do is spin, right? They cannot perform surgery or they cannot get closer to your sterile field. You are not, the surgeon's now sterile, so you are gonna dance with your surgeon. You're gonna get that tag, they're gonna spin around, you're gonna stay in place, remove the tag, and we're done. Hopefully that gives you a little bit of understanding when it comes to gowning and gloving your surgeon. Okay, I think I have one more video. I want to teach you guys how to pass the course, but if I don't do it today, that is going to be your next assessment, which is we're going to learn how to set up the entire main sterile field so we can get ready for surgery and perform the timeout. Okay.